Hi, guys. It's Sarah, and today I have a really interesting guest. I happen to know her really well. It's my cousin Heidi. Heidi, thank you so much for coming on today to talk about what you do for a career.
Sure, glad to be here.
Thanks. So, I am starting to do a new series called like a day in the life of. And so, Heidi's my first guest in this new series, and she is a dental hygienist. And so, for anybody out there that is thinking about going into this as a career, I figured it could be really helpful to listen to Heidi's experience and any tips and tricks that she has for us. So, Heidi, what made you want to get into being a dental hygienist in the very beginning?
I was a dental assistant straight out of high school. Um, and so I did that for about 12 years. And during that time, my husband was a carpenter and he got laid off. And so he'd been laid off for a while. And like, you need to go to school. And so he went to school. Well, when he was done, he's like, well, you need to go to school. So I worked when he went to school, and then he worked and I went to school. And so I
Wow.
became a hygienist. So it's kind of a natural transition from dental assistant to hygiene.
Okay, got it. Thank you. So do you enjoy being a hygienist more than when you were a dental assistant?
Oh, for sure. Yeah. You work less, get paid more. It's,
Okay.
yeah. And I don't know, you get more of a relationship one-on-one with the patient. It's not
Yeah.
so much, cleaning and doing maintenance and a lot of hard work like the assistants do. It's more one-on-one with people.
Got it. Oh, that's a really good way to put it. Yeah, I was thinking maybe an assistant would, you know, have more variety, but like you're saying, you have more relationships
Yeah,
probably with the.
definitely.
Okay, that's awesome. And then, do you, sorry for some of these questions, they might seem
Yeah.
silly, but like, do you have to clean your own tools or the assistants do that for you too?
Um, it depends on where you work, really. Some
Okay.
places have assistants that take care of the hygienist all day.
Oh,
In my
cool.
case, I kind of box up my instruments, clean my room, and then they take care of like the sterilization and that kind of thing.
Okay. Nice. Okay. So I'm getting the feeling like I know it's not your own business, but it almost seems like it would feel like it's your own business. Like you're in
Um,
charge of your own world.
Not really. I
Oh.
mean, I have a set schedule. I had come in and my patients are set up for me. I do have
Mhm.
some control over my schedule, like if I see something that won't work or if I
Mhm.
want to change things around, I have that power.
Okay.
But still, I work with a team and we
Okay.
work together.
Okay. Gotcha. Gotcha.
Yeah.
Um, so can you speak to, well, first, let's go back to the educational part. How much education? So, as a dental assistant, did you get trained on the job? And then, as a hygienist, how much college did you have to do? And what was the difficulty level, etc.?
So, to be a dental assistant, you can get trained on the job. I didn't. I went to skill center in high school.
Oh, cool.
And so I had some idea. I mean, they don't teach you everything in those programs, but I had a basis. And then I got a job out of high school where they taught me more. Hygiene is a more professional program. You need a bachelor's degree.
Mm.
So it's 2 years of prerequisites, science, math, English, basic gen ed kind of stuff, a lot of
Mhm.
science and math for the prerequisites. And then you start the hygiene program. You have to apply for the program. It's usually pretty competitive.
Hmm.
There's usually several hundred people applying. In my school, we only had
Wow.
18 accepted. So you have to
Wow.
get pretty good grades in your prereqs and have other things like I was a dental assistant, I spoke Spanish, things
Mm.
like that help you get in the program. And then once you're in the program, it's 2 years. It's classwork, still a
Mhm.
lot of science, and then clinical work too.
Wow. Okay, so that was a lot of dedication,
Yeah,
sounds
it's a
like.
four year thing you got to pretty
Wow.
much be focused on.
Okay, gotcha. Um, so sorry, I had a question, I was hanging on to it. Just went out the window. Um, oh, yes, I remember. So what you just explained, is that how it is across the board, no matter where in the country you are, or is that just for Washington?
No, it's pretty much everywhere. There used to be programs that were just associates programs, but they still added up to being 4 years by the time you
Okay.
do the. In fact, my program was that way back when I got my degree.
Hmm.
I graduated with an associate's, and then I did a couple more quarters with in Oregon online and got
Oh,
my bachelor's completed. Now my school that I went to offers just a bachelor's degree. Kind of
oh,
stinks because I did the
yeah.
4 years and I still had to go extra, but now they get the bachelor's degree with just the 4 years.
Okay. Well, that's good to know for anybody
Yeah.
looking to get into it. And it seems like you had kind of a, I don't know if it's unique, but I just remember it as unique situation where can you explain what happened where like your employer like reimbursed you for some of your college in order to
hmm
dedicate some time to them?
Yeah, it's actually a federal program. It's called, let me think, healthcare, something core.
Okay.
Anyway, it's a federal program that encourages healthcare workers to work in high need areas.
Oh.
And so if you work in kind of a rural area in a community health program, they will pay your student loans off up to a certain amount. For a hygienist
Mm.
at the time that I did, it was like $60,000 for a
Wow.
2 year commitment. And you're
Mm.
still getting paid your normal
Hmm.
wages, plus they do that on top. So
Wow.
it's a really good deal. I didn't have to worry about my student loans at all. I never paid anything on them. And I was a mom and married, and so I racked up quite a bit of loans and it was
Yeah.
taken care of. But you just have to make sure that you're in a federally designated need area. It could be on an Indian reservation. There's community health clinics where I work now.
Hmm.
And I mean, I finished my 2 years a long time ago, but I still enjoy working in that setting. So
Oh,
it's a good
that's
program.
great. Oh, I love that. That is so good. Do you think that's pretty rare, or do a lot of students that are going to college know about these programs?
I don't think a lot of them know. I think they think that private practice is more lucrative or
Hmm.
cushier or something. I don't know. I know most people are geared towards private practice.
Okay.
Um, but working in a community clinic has its rewards, and the loan payoff is a huge one.
Huge. A huge one,
Yeah,
yeah.
yeah,
Um, yeah, so if you add that on top of what you were paid, you
mhm.
were really making good money to not have to
Yeah,
pay
yeah,
that back with after-tax
right,
dollars.
for
So
sure.
that's awesome. So then the next question would be, do you get paid less for working in a how did you call it, a higher need area?
No, actually, it's at least my clinic where I'm at is highly competitive
Mm,
wages. At one point, I was going to switch. I used to work at a different community clinic, and I kind of was looking for a change. And so I applied at some private practices. One dentist straight up told me, he goes, "You're at the top of your pay scale. I can't pay that much."
really?
Yeah.
Wow.
And so
Wow.
I ended up where I'm at another
Yeah.
clinic where I was able to get what I needed. Plus, most community clinics are larger organizations where they
Hmm.
can offer full benefits. I
Mm.
pay nothing for my health insurance or dental.
Wow.
They cover everything for me. I get generous paid leave. And so,
401k and stuff like that too?
yeah, yeah, all of it.
Really?
And so,
Wow.
and most small private offices can't afford to do that for their hygienists. So it has
Okay.
its definite advantages.
I wonder why they can, because it's an organization, even though it's in a community that, that serving a community that needs help, maybe they're federally
Yeah,
funded. Is that why?
almost all our funding comes from federal and
Okay.
state. Yeah.
Okay. That's
I
great.
mean, patients pay for their services in some cases, some are Medicaid. But
Hmm.
if we relied only on what the patients brought in,
No.
we wouldn't function. It's from the help of the government.
Wow. Okay. So this is actually really exciting for somebody that maybe has an adventurous spirit in them and they don't want to just go to some big city. Maybe they want to
Right.
go, I don't know, I'm just throwing this out there. Maybe they want to go to Hawaii or
hmm
Tonga or some well, I guess it would have to be a U.S. territory,
Yeah.
but Guam,
Yeah.
right? Someplace where there's a federally funded program,
Uh-huh.
and they can kind of live a unique life and have an adventure and not have to sacrifice on getting
Right.
paid. And yeah, that's great. Um, so you said working at a community clinic has its rewards. My first thought, and this is like shame on me, I probably should not have this as a first thought, but my first thought is maybe you would encounter maybe like people that are not taking care of their hygiene at all, and
Mhm.
like really maybe like gross cases. Um, is that a false generalization that came to my
Uh,
mind?
I mean, you see stuff like that in private practice too. In community health clinics, we get to meet people who are recent immigrants. Maybe they just got here from another country. They don't have a lot of education about uh, hygiene things that we do here.
Sure.
Um, we in some clinics, I've worked in some where you deal with homeless people or people who are disadvantaged in other ways, recovering from substance abuse,
Mm,
mental illnesses, things like that. Those clinics can be difficult just because of behavioral cognitive issues.
yeah.
Um, but it's a challenge. I know a lot of hygienists get bored and kind of burn out in private practice.
Hmm.
With me, pretty much every patient is a different case, a different story,
Mm,
and it makes it more challenging and fun.
I love that. That is a great answer. So just the variety is what you
Mhm.
feel has kept you going and not feeling burnt
That
out.
that and you're actually making a difference in someone's life. They're not there for a
Yeah.
cosmetic procedure or just a routine they've done their whole life. It's something that you're actually teaching them to have
Hmm.
better health.
Yeah. Yeah. Potentially life changing for them
Right,
too, right? They might
right.
get a new set of teeth or something.
Yeah.
And yeah.
That, or I mean, I've had people come in with like massive staining, bleeding gums, and by the
Mm.
time we get through some treatment, they're smiling and happy, and it's
Aw,
huge.
that's actually pretty special,
Yeah.
the priceless, that, just a smile can make a
Mm-hmm.
huge difference in somebody's confidence and
For
as they
sure.
present themselves in life.
Mm-hmm.
I love that. No, thanks for bringing that side of it out. That's really
Yeah.
cool. Um, so I'm keep on forgetting my questions today. Um, have you worked on anybody that, well, I keep forgetting. You're a hygienist, so I was just gonna ask, like, have you worked on any, like, broken teeth and stuff like that? But
Oh
you
yeah.
probably have in your past.
Well, as a hygienist, I do fillings.
Oh, that's right. Okay.
So yeah, I fix teeth one day a week.
Okay.
In Washington State, hygienists can do anesthetic and restorations, so fillings,
Cool.
and clean teeth. It's not just cleaning teeth. Some states are a little behind and only let them clean teeth. Washington's a little more progressive, so that
Cool.
makes the job a little more fulfilling because you have more variety.
Love
Um,
it.
and that's a good thing about working in a clinic also is generally you get to do more what we call expanded functions. So doing restorations in a private clinic, that's not as common.
Okay. Okay. Thank you. So then do you have to get like an extra certification or anything like that to be an
No.
expanded functions?
In Washington State, it's required. To be a hygienist, you have to pass boards doing fillings, anesthetic, the whole bit to even be a hygienist. Other
Hmm.
states, they split it up and you can choose to do it or not.
Okay. Okay. And then back to the pay question. Do you obviously get paid more because you have more responsibility in those states that allow that?
Yes, Washington, California, Alaska are the highest paid for
Mm,
hygienists just because we have most responsibility and most skill.
okay.
I know, like in southern states, it's a lot less because they're very limited in what they do.
Okay. Gotcha. So would you still, I remember a long time ago you had told me that Alaska is a great place to go work as a hygienist.
Mhm.
Is that still the case today?
I think so, yeah. They're pretty progressive. They allow what's called a dental therapist. So,
Hmm.
with a master's degree, I believe, uh, the hygienist can work on their own. Again, in high need communities, generally with native populations, it's just to fill access of care. There's not a lot of providers there, and so they give the hygienists or the hygiene therapists more leeway in the things they can do so that they can help those populations that are isolated.
That's a great opportunity. I love it.
Yeah.
Um, so for somebody that's just being exposed to this world, maybe for the first time on this video, can you talk about um, income ranges that maybe they could expect in like the first 1 to 3 years,
Mm.
and later? Is that possible?
It really depends on where you live. Yeah. Um, I would say, like in the Northwest, you could expect probably not less than $40 an hour straight out of school, up to, for experienced hygienists in a metropolitan area, up to like $70 an hour.
Okay. So you're always hourly, not salary
No,
in that range?
some people are salaried, but hourly is more common.
Okay. So off the top of my head, I'm just guessing. I think 40 might be close to 80,000 a year.
Yeah, I'd say probably most common is about 100K.
Okay, like an average.
Yeah.
Okay. And that would be a couple years out of school
Hmm.
to reach
Yeah.
that point.
Yeah.
Okay. Hey, that's not bad. I mean, a lot of
No.
people are getting bachelor's degrees and not making anything.
Yeah, yeah.
Right on.
For the education, I think hygiene is one of the best returns on investment.
Nice. I love that. What about the physical toll it takes on your body, like
Yeah.
leaning over and just can you speak to in addition to what I just said?
Yeah, it's real. You do, get stronger with time. At first, when you first start, it's hard. Your neck hurts, your shoulders hurt, everything hurts. Um, but you get stronger. You learn to take care of yourself. I do mobility exercises every morning,
Mm,
stretch out in between patients. You have to be very aware of ergonomics, posture, taking care of yourself. My main problem is I have arthritis. And
mm.
so I actually had to get one of the knuckles and one of my fingers fused because,
Really?
yeah, the arthritis just went really bad and I got an infection in my joint. But it's
Wow.
still usable. I mean, it didn't hinder my career at all.
Yeah.
But I was off for like 3 months with that.
Mm.
But that was complicated by my own body. Not everybody has that happen.
Sure. Okay.
But yeah, sore hands and neck are probably the most
Yeah.
common thing.
Yeah, because you're constantly leaning over, so just holding
Yeah,
that 8 pound
and
head.
looking down.
Hmm.
I work with loops, which magnify what I see, but also it's glasses with the magnification portion is slanted down. So
So you
if you
still have
work,
to look down.
well, no, it helps you
Oh.
sit up more because the
Oh.
magnification is slanted down. So you're looking more forward, but
Oh,
you're
cool.
seeing down. So that using things like that really
That's
helps.
that's neat.
We also have some suction things that like hook into the patient's mouth and it holds their lips and tongue out of the way and it's suctioning so that you're not having to hold the heavy suction while you're working so much. So
Yeah.
finding things like that that are ergonomic to make your life easier are definitely worth it.
Okay. Okay. Yeah, I experienced that for the first time, like 1 or 2 visits ago to the dentist, and it was pretty cool. I actually really liked it. Yeah. So it's good for the patient too.
Yeah.
Um, okay. So yeah, I was curious if like dentists get the arthritis in their hands also, or you think that's just your
Um,
genetics?
Dentists kind of have an easier job as far as ergonomics. They move around a lot more. They
Okay.
usually are seeing 3 or 4 patients at a time. So the assistant is doing a lot of the work and they come in and do something and leave. As a
Mm.
hygienist, if I'm doing perio, which means I'm cleaning teeth, I'm in there for almost an hour in basically the same position.
Yeah.
Also, when somebody has a lot of calculus, which is like bacteria hardened onto the teeth, it takes a lot of physical force to get it off. Um, it's technique sensitive too. I mean, the better you are at it, the less hard it is. But
Mhm.
dentists don't usually have to use that much force except for when they're taking out teeth. But it's a lot faster.
Oh,
It's not all day like we do. So physically,
okay.
hygiene's the hardest. Yeah.
Okay. Okay. That's good to know. I remember hearing a statistic a long time ago that out of all the professions, that dentists were the most prone to depression
Yeah.
because their world is so myopic in a mouth.
Yeah.
But I suppose that would apply to a hygienist as well. What's your
Um,
thoughts on that?
In some ways, yeah, because I mean, we're so focused on such tiny little things, and you get people coming in every day saying, "I don't want to be here. I hate the dentist." Blah, blah, blah.
Yeah.
So
Yeah.
if
True.
you really let that get to you, yeah, it could get frustrating. But most dentists have additional burdens where they are the head of a team. They're dealing with staff issues, business issues. A lot of times they don't get training in dental school on how to run a business,
Hmm.
management, things like that. And so they're more a scientific mind trying to deal with all this stuff. And I think that's
Yeah.
their main issue in the depression and that
Okay.
idea.
That makes a lot of sense. So hence that's why they hire like office managers and stuff to
Yes,
run that part for
definitely.
them.
Yeah.
Okay. Um, Back to the career path. So you ended up deciding to just stick with being a hygienist, which is awesome.
Hmm.
Obviously, it's been a great career choice for you,
Hmm.
all the perks that you mentioned earlier. But if somebody does want to go to the last, is it the last step to be a dentist basically in this career
No,
path?
you could be a dentist, but there's specialties in dentistry too.
Okay, okay.
Yeah.
And what kind of, how much more schooling would you have to take after you're a hygienist to be the dentist?
Uh, it would be 4 more years of dental
Oh,
school. Yeah.
oh, okay.
So they
Wow.
usually go 8 years or more.
Okay.
If you're in a specialty, 10, 12 years.
I wonder if the community clinics reimburse them too.
They do. Yeah. It's the same
Wow.
program. Yeah.
That's so cool.
Yeah.
Okay. So yeah, somebody could do 8 years of schooling for free.
Yeah. It's like 2 years at a time. They give them a certain amount and then they can re-up and keep going until they
Wow.
have it paid off.
That's
Yeah.
amazing. Okay. Well, that's super exciting. Yeah. Uh, what is your least favorite part of your job?
Mm. Probably dealing with people that don't appreciate what I do or don't even want to be there and make my life difficult.
Yeah.
uh, Patients can be the joy of my job and they can also be the most difficult part. Some people feel like it's their lot in life to complain about everything, even when you're trying to do something nice for them. So,
Yeah.
yeah, that's difficult for me. I like people to like me.
Yeah, yeah, and be grateful that,
Yeah.
you're there helping them for very, very little cost on their
Yeah.
end.
Yeah.
Okay, no, that makes perfect sense. At least, on the bright side, most of the time they're not able to talk because your hands are in their mouth.
True.
So, just keep them busy.
Yeah.
Love it. Okay, so then conversely, top 3 or however many you wanna list, but, like, your favorite parts about the job.
Like I mentioned before, making a difference in someone's life. Somebody who's, self-conscious about their smile, doesn't smile, somebody who has difficulty eating, things like that.
Mhm.
You can make a huge difference in their life, and they're usually so grateful for that. Um, I like teaching people with special needs. We have a lot of patients that have autism or Down syndrome,
Mhm,
things like that. And I like spending time with them, like actually physically teaching them how to brush their teeth, how to
mhm.
floss, how to get on a schedule. I have autistic patients that come in and I ask them how they're brushing and So like
Mhm.
I brush at 7 a.m. and 7 p.m. I floss at 7 p.m. They have their schedule, and
Mhm.
it's made a huge difference. Usually they have the best teeth out of everybody because they listen and do what I teach them.
That's awesome.
And so,
They're good patients.
yeah. And and also hygiene is a good job just for balance in life. I don't work weekends. I don't work nights.
Mm,
I have
good
a
points.
regular schedule.
Mhm.
I go to work and I leave it at work when I come home. I don't have anything I have to be thinking about or doing.
Yeah,
And so I really enjoy that about my job too.
I love that. Do you get to work 4 days a week or like
Hmm.
do you work 10s
Yeah.
or 12
I
sometimes?
work I work 4 10s.
Okay.
That's also kind of unusual for a hygienist. Most of
Mm.
my friends are like, "How do you work that much?" Because
Mm,
I'd say the majority of hygienists work 3 to 4 days, 8 hours a day.
okay.
So yeah,
Like part-time and making full-time
right.
income.
Um, no, they'll still get paid hourly, but
Oh,
we
okay.
make enough hourly that it's okay for them. And
Yeah.
um, I did work when my kids were younger about 3 days a week for quite a while. And
Okay.
then as they got older and needed more money and less time from me, I bumped it up. And so,
Yeah.
and I probably will in the next few years once my boys are settled in their adult lives, kind of cut back again.
Yeah. Okay, nice. Nice. So since you said earlier you do have full benefits and stuff, does that mean
Hmm.
that you will be able to actually retire and be okay from a
Yeah.
hygienist world?
Oh, yeah.
Cool.
Yeah, I have a great 401k I've been working on since I was 20, so I'm doing
Cool.
good.
Okay, great. I feel like that might be unique in the dental world, because I feel like a long time ago when I worked at an office in Colorado, I remember the hygienist lamenting that she
Hmm.
was not prepared for retirement.
Yeah.
Is that true that other offices don't offer
Yeah.
packages like that?
Yeah, a lot of, well, it's getting more popular now for them to offer that just because it's hard to find, good hygienists. And so
Mm-hmm.
they're starting to offer it. But years ago, yeah, small offices never offered retirement.
Hmm.
Um, and where I was an assistant, I was fortunate to have a boss that really believed in that.
Good.
And so, yeah, I started at a young age saving. But yeah, there are a lot of hygienists that don't have anything unless they did something on their own, like an IRA, things like that.
Mm, okay.
But yeah, that's a real perk of working in a larger clinic.
Okay. A larger clinic slash community kind of clinic that is
Yeah,
federally funded is the key there,
well,
right?
there's that, or no, there's private clinics also, or
That offer it.
corporate
Okay.
clinics, yeah, that
Hmm.
that offer full
Okay.
benefits too.
Um, Back when you said that there were hundreds of applicants and only 18 got in,
Hmm.
is there a hack that you know of for somebody that maybe you were just going to a really competitive school, right?
Hmm.
Is there a place like can somebody go take a hygiene school somewhere and like not have such a hard competition?
It's pretty much that way everywhere.
Okay.
Hygiene is a hard career. You need to be uh, scientifically minded. You need to be able to make clinical judgments. And so they really put the standard really high.
Hmm.
And a lot of people want to do it because, it's a good job with a good schedule with good pay. And so there's
Yeah.
always like a high demand trying to get into it, but they have to be really critical with who they let do it. So yeah, it's pretty much that way everywhere. The main thing for if you want to get into hygiene program is do well in your prerequisite courses. Um, GPA is the biggest determinant in getting in.
Mm,
Um,
okay.
Aim for 4.0, but they'll tell you, 3.5 is the minimum to apply. But I'd say most people have 3.7, 3.8, if not 4.0.
Wow. Okay. Well, that's really good to know. So when you're sitting in the hygienist chair, you know that that person like it really achieved to get
Yeah,
to where they
yeah,
are.
it's not easy to become a hygienist. So if you're a hygienist, you made it through all that, then and plus you
That's
have to
cool.
take boards, so clinical boards where they test your skills in
Mm,
hygiene and restorative and aesthetic, plus a
Mm.
national written board that like tests everything you ever learned in school, like the most random
Oh,
things.
wow.
So yeah, if they've gone through all of that, then they should be, pretty knowledgeable.
They're a smart cookie.
Yeah. And
Wow, that's great.
that doesn't always translate to, clinical skill. That's another thing. Hygiene, you need to be gentle but effective. And so they
Mhm,
teach you that in the actual program.
mhm.
And so some hygienists, they just don't have that skill. And so even if they're book smart and make it through, it's a tough career, and they usually don't end up staying in it if they're not able to be that way.
Can you expound on that? Because, forgive me for this, but my initial thought would be, you're just cleaning teeth. Like, it sounds easy. So expound on that for someone like me that just doesn't understand.
Okay, so there's a difference between just cleaning teeth, like maybe just running the polisher over on, like maybe an assistant could do.
Mhm,
We do what's called periodontal therapy, and so generally it involves, cleaning underneath the gums and in the pockets of the gums
mhm,
with very sharp instruments. Those instruments can cause damage if you don't use them correctly, either to the gums or the surface of the tooth.
mm,
And so it takes a lot of practice, a lot of skill to be able to remove deposits that possibly have been there for their entire life or many
mm.
years, without injuring or making the person uncomfortable.
Yeah.
Um,
And the people are
so
awake. They're awake. They're not under
yeah,
anesthesia, so they're moving.
no, no, yeah. We can do anesthetic to make them numb, to make them comfortable, but yeah, they still feel vibration, pressure,
Yeah.
all of that. And so yeah, it's a skill. And then doing anesthetic, generally hygienists are great at anesthetic because we get a lot of training on it. A lot of times the dentists have trouble with getting somebody numb, they'll come and get us, because
That's
we're
pretty cool.
really good at it and really gentle. Usually patients like us to do their anesthetic.
Mm, cool.
So that's another skill to have. And then doing restorative, doing fillings is hard. It's
Mhm,
not just plugging a hole. It has to match the person's anatomy. Each tooth has a specific anatomy that you need to learn, but then there's variation in each person. So you need to make sure that it fits their anatomy, their bite, the way they chew. So it takes a
mhm.
lot of skill to learn how to do that.
Got it. No, that was a great explanation. Um, so leading off of that, I know you've written some articles. Can you talk about that? Is that like a hobby, or is that something that your clinic asked you to do, or like why did you
No.
start writing articles?
Um, I was reached out to about writing something about working in community health. Uh,
Okay.
so I did that first article, and then they liked it, and so I kept writing a few articles here and there. Um, it I've always enjoyed writing, so it's just something that I like doing.
Yeah.
Uh, it's not a huge money maker, but some hygienists gravitate to like academics, that kind of thing, and end
Hmm.
up doing that for a career. I can't see myself doing that.
Okay.
It's kind of just like a side thing that I like to do sometimes.
Cool.
Um, yeah.
I like it. Okay. Well, that was one of my next questions. Like if your arthritis gets worse in your hands
Mhm.
or you just get tired of the day to day,
Yeah,
that's something that maybe you could do
right,
casually to continue the income later
right, right.
if you had
It
an
would
interest.
take a lot. I mean, I would have to write like 10 articles a day to make what I make now.
Oh,
But,
well, yes. Okay. Okay. They need to
but
up the pay.
yeah, for sure.
Okay.
But there's
Um,
other things hygienists can do if they can't work clinically anymore. Teaching. I have filled in as a substitute teacher at the college.
oh, cool.
So that's something that I could do, if I was disabled clinically. A
Yeah.
lot of hygienists go into research. They work for toothpaste companies,
Ah, yes.
um, like supply
That would probably
sales.
pay good money.
Yeah, you can do that kind of thing.
Yeah.
You can do like in supply sales, a lot of times they do training for dentists, things like that. It's a
Hmm.
good thing to do. So yeah, there's other careers you could do with a hygiene degree also.
And I suppose, I mean, having wonderful grades and things like you already mentioned, you could probably also be like an office manager if you ever wanted to be. I don't know if that would be.
Yeah, generally that would be a pay cut, so probably
Oh, really?
not.
Okay. Okay.
I don't know,
Okay.
maybe it's different somewhere else.
Okay.
But
That's good to know. I assumed that they made pretty good money, but maybe not.
yeah,
Okay.
I wouldn't like that job just personally. I'm
Yeah.
sure some hygienists would.
Yeah.
I don't like solving problems that much, so
Yeah.
so
All
yeah.
the drama in the
Yeah,
office that, yeah.
yeah, that's not my thing. I kind
Yeah.
of stay out of that. So
Stay
yeah,
in your
that
own
wouldn't.
little room and just work on
Yeah.
what you're good at. And
And
yeah.
that's a perk of being a clinical hygienist. You're in your
Okay.
own little world and you don't really,
Yeah.
I mean, I work together with the assistants, but we're not like face to face all day. And
Yeah.
I don't have to tell them what to do. They do their thing and I do mine. So
I love that. Yeah. So autonomous. That's good.
yeah. Mhm.
Okay. So just a kind of a personal question, where do you stand on fluoride? Do you think fluoride is bad for our health, or do you think that it's necessary for hygiene?
I think if you ate a tube of toothpaste every day, yeah, it would be bad for you. um, if you're like ingesting massive amounts, yeah, it would be bad for you.
Okay.
However, it's a naturally occurring element on the earth. Um, Fluoride is in the soil, it's in our food, it's in our water. I have well water. It's not artificially fluoridated, but I tested it and we have quite a bit of fluoride and
Oh,
it's
well, that's
natural.
cool. I did not know that.
Yeah, so it's a natural element that we have in the earth. Uh, and when you see people who come from highly fluoridated areas, for example, in central Mexico, I work with a lot of patients from central Mexico. I've seen people come who have never been to their dentist in their life. They're in their middle ages, 50, 60 years old,
Mm-hmm.
and have never had a cavity. Um, they
Hmm.
have healthy gums, healthy teeth. They just need a light cleaning and they're good.
I
Um,
wonder how much of that is diet related, though. Like they're still
it's
eating just
not.
natural. Okay.
It's
No.
not. They eat a lot of processed foods. When
Okay.
we talk about diet, yeah,
Okay.
I would
Huh.
expect them to have cavities and they don't. Fluoride,
Interesting.
what it does is it makes the minerals in your saliva, so calcium, phosphates, things like that, bond to your enamel, make
Hmm.
your enamel remineralize. So if you're eating a lot of acidic foods, limes, oranges,
Mm-hmm.
sugary sodas, things like
Coffee.
that, yeah, anything carbs, sugar wise, or acidic will weaken your enamel. And
Mm-hmm.
then bacteria that live in your mouth also produce acid. And so basically, you have like a chemical burn on your tooth, and that's what starts a cavity.
Mm.
Um, Later, if you're using fluoride, the saliva has minerals in it that can remineralize that and essentially heal your enamel.
Hmm.
So you avoid getting cavities before it actually gets into the tooth. And so that's the advantage of fluoride. But like in all things, it's a balance. Um, we
Okay.
usually tell parents to use baby toothpaste that doesn't have fluoride in it while the kids are small and aren't able to spit it out,
Mm.
because you don't want them, swallowing large
Swallowing.
amounts. But when it's at a regulated certain amount, ideal amount, it's super healthy for
Hmm.
development of teeth and also a topical remineralization agent for adult teeth.
That's interesting. I wouldn't think that just brushing your teeth for 2 minutes would be enough of a difference to actually, you know, remineralize. But apparently it is.
Yeah, it
Okay.
is. And there's also different kinds of fluoride. If you get a toothpaste that has what's called stannous fluoride in it, it has what's called substantivity. So the fluoride has action that lasts longer than it's actually in contact with your mouth.
Oh,
Um,
so
and
that's a
stannous,
good one. You
right.
recommend that?
Yeah, it also has the property where it destroys bacteria, and that goes
Mm,
on for a while after you use it. And bacteria is the main thing that causes damage in your mouth as far as gum disease and decay. So if you're using that type of fluoride, it's continuing after you brush to kill those bacteria and causes ongoing benefits throughout the day.
that's really cool. Have you ever heard of probiotics
Mm-hmm.
for the mouth? Do you
Yeah.
recommend them?
I would, yeah. So there's a theory about um, the environment of bacteria in your mouth.
Yeah,
There's a
like
there's a
terrain
real
theory.
Yeah, there's a real balance. There's an ecosystem that lives in our mouth. There's good bacteria and there's bacteria that causes damage. And the imbalance of those bacteria is what causes the most damage. So you want to nurture the good bacteria and
Did I know?
cause a
No.
inhospitable environment for the bad bacteria, and that's what probiotics does. Yeah, so yeah, probiotics are kind of a new thing that people are using, and there's a theory about the microbiome in our mouth. The bacteria, we have good bacteria, we have bad bacteria, we have hundreds of species of bacteria in our mouth. Um, and so the goal is to nurture the bacteria that's beneficial for health and make a bad environment for the bacteria that are harmful to health. And probiotics can help with that.
That's so cool. I love that. Did they have to get a prescription or do you know where people can buy it or just
No, there's over the counter kind of things I've seen on the market. I haven't really tried them. You can get some through your dentist. Our clinic doesn't offer them, but I know a lot of private dentists do. There's like gums and lozenges that have it. The other thing that is helpful is any gum, like extra Trident, that has a sweetener called xylitol in it.
Mm,
And xylitol actually is harmful to the bad bacteria in your mouth. So that's a good thing to look for also.
I love that you said that. There's a dentist on YouTube that I find fascinating because she kind of turned my paradigm upside down on how I understood the stuff. And her name is Dr. Ellie Phillips, and her her whole explanation, I guess, on how to avoid getting cavities is about the pH balance in your mouth.
Hmm.
And so one thing she recommends is after every meal that you chew xylitol gum,
Absolutely.
or suck on xylitol mints after every meal.
Mhm.
And and then she talks about, well, she's got a certain like product system that she likes people to use, but the whole point of it, she says, is it puts your mouth pH back to where it should be so
Mhm.
that the bad bacteria don't start causing, the plaque and the decay.
Yeah, that's true. The pH, you want to keep as neutral as possible. And our modern diet is very acidic.
Mhm.
And that causes a lot of trouble in people's mouth. So anything you can do to neutralize the pH, and it's not just xylitol or products that you can buy. Drinking a glass of milk helps, cheese,
Mm,
even drinking a glass of water after you eat and kind of swishing it around
mm,
will help. You just don't want to leave sticky, acidic foods sitting on your mouth. Um,
okay.
Even just, after eating, brushing, and flossing neutralizes the acid in your mouth.
That's cool. I would have thought that milk would be too sweet, maybe, like,
It does have naturally occurring sugars in it, but it also has a neutralizing quality to it.
cool. I love that. Well, that's awesome. Well, I've kept you on a long time. It's been super fascinating. I've really enjoyed it. Do you happen to have any thoughts, any last comments that I haven't asked you that maybe you want to share? Any tips or tricks or just anything on your mind?
Uh, just that if anyone's considering hygiene, it's a good career. And I would encourage them to pursue it and look into it and talk to hygienists, spend time in the office, see if it's something that you would enjoy. it does take kind of a different personality to enjoy. You have to be pretty self-motivated, not grossed out easily. Enjoy working with a variety of people. So yeah, kind of think about if that's in your skill set and then look into it.
Love it. Thank you. That was wonderful. I thoroughly enjoyed it, and you were a great guest. So I really appreciate it. Thanks, Heidi. Bye.